I love the topic. It's export potential of allied health. And this is what we envisaged when we started our school in 2017. The idea was to create an institution that would deliberately prepare persons for North America.
Exporting of practical nurses in Jamaica, I have not seen much on my point of view, from the association's point of view. But people are always calling the association wanting to make sure that they can go overseas. They want to register because they want to go overseas. And I'm always directing them to the Ministry of Labor because I don't have the authority to say, okay, yes, we're going to send you abroad and stuff. But I've seen others who have gone, but when they've left Jamaica, they're always working under the table. Most of them work under the table. For those who have gone to school, and I must say, use SMTC, they are trained to work overseas. So when Ms. Spencer sends them, they're working legit. But a lot of the practical nurses that leave Jamaica that I know of, they're working under the table. And we are hoping that could stop, because once they do that, they're either in the country illegally, working illegally in another country, and if something should happen, they might just lose their benefits. And when they do leave and is there, they always overstay their time, so if they come back, they lose their visas and stuff like that. So, we're hoping that that can stop, because a lot of people would love to travel, but because they're always working under the table, they're losing their visas and stuff like that. So we love that to stop.
Thank you. SMTC meaning Strategic Management and Training Consultants.
That's
SMTC.
the parent company.
The parent.
Parent
Got you.
company.
Dr. Day.
Well, I'd like to bring a different perspective to this. Tourism is an export industry. And if we can provide the support services, the allied health support services to feed the tourism industry here, or tourism industry worldwide, we are then part of that export component and allowing the people, as you said, to work legitimately. But when you look at it from the private sector perspective, which is what SMTC has done, Mrs. Dinham Spencer has looked at the opportunity and created the training environment here alongside the international certification that will allow people to go forward. So we don't have to be creating an environment where people need to run off and work under the table. But if we understood how to connect dots, again looking at tourism as an export industry, looking at the myriad of opportunities and health and wellness occupations under that, and some of the new products we could create here and offer it for the rest of the Caribbean and the rest of the world, there would be many more SMTCs and there would be many more opportunities for people to work legitimately. Because if you look at hospitality, it's an HB2 visa, so you can go through tourism a different route because you have the skills.
So you're saying we're perhaps looking at the issue the wrong way, or we should look at it another way?
We usually look at the issues the wrong way. There are many different routes to Rome.
Thank you very much. Mrs. Dinham Spencer.
Thank you. I love the topic. It's export potential of allied health. And this is what we envisaged when we started our school in 2017. The idea was to create an institution that would deliberately prepare persons for North America. We looked at a number of schools here, and we didn't see that finishing school type of approach, knowing that you are going to be going to a different country, a different culture, with different rules and protocols. We felt that we wanted to prepare people so that they wouldn't go, as Nurse Powell says, under the table, or that when they go, it would not take them long to assimilate. What we found is that the market was not ready for it. We were ready in 2017. But 2017 and 2018 and up to 2019, we really struggled. But we continued because we felt it was like my mission to really bring this to Jamaica. So we feel very strongly that preparation of persons, just like they do in the hospitality industry, where they prepare them. They go on these programs, they come back to Jamaica, they do very well, they're polished, and so on. There is an opportunity in the United States to use the EB3 visa approach. It is an approach that allows someone to get a permanent residence in the United States with this kind of visa. We are dealing with persons in the United States, organizations that will offer that. But the opportunities are endless for Canada, for the United States, for the UK, and even, surprisingly, Australia. Our people can go to all of these countries, but it is preparation from Jamaica that is important, and that is what our mission is.
Thank you very much, Dr. Weaver.
Yes, thank you for the opportunity to speak on this matter. The potential for having people be trained here in Jamaica and be sent to work in the US, the UK, Canada, the potential is almost unmanageable. It's just so huge. The potential is just so huge that it boggles the mind sometimes. The truth is, though, that our nursing system here is not geared appropriately to support institutions that will have this kind of focus, preparing people here and to have them exported into the US or UK or Canadian market. Now, at this point in time, the nursing fraternity is covered mainly by the Nursing Council. They give us the legitimacy to practice in our within our society here and to assist when we travel. So they make sure that the quality of training is up to par. But the Nursing Council has absolutely no jurisdiction, control, support for allied workers, like the nursing assistants and groups of this kind. Now, without that kind of institutional support, who is going to go into these institutions to ensure that they are accredited? Who is going to check to see whether the curricular material that they're using is in keeping with all the other institutions? Who is to say that once we have somebody trained as a allied worker, that that person is on par with another school?
Yes.
Who is going to provide that umbrella? And that's supposed to be the Nursing Council at this point in time. That doesn't happen. And if that doesn't happen, that creates a problem. However, we know that the potential is there, the need is there. So many workers go over to the United States without qualification and actually work over there in homes, taking care of families and stuff like that,
Thank you.
without qualification.
We'll delve more into a lot of these things. We've just been joined by Sophia Kelly Davis. Thank you so much. And I'm going to throw everything on you now. First, you can introduce yourselves quickly, and then you can also tell us your thoughts, your initial thoughts, about a minute or so on the export potential of allied health workers.
Okay, so I am Sophia Kelly Davis. I am a registered nurse. I just finished my master's degree in nursing education at the UWI. I'm actually a part of SMTC as an instructor. So I'm very happy to be a part of this team. Now, for the opportunities you had said.
Yes, the export potential for allied workers.
The potential is very great. Why I'm seeing where we have a very dynamic, team working with here within our facility, and we try as best as possible to prepare them in a very, meticulous way, in that way that they can, progress in a better way of life, if you understand what I mean, when they here sometimes we have deficit as it relates to resources, etc., to give the best care that we want to give. However, when you transition abroad, you have that facility, you have those resources to work with to give the care that you'd want. You realize that sometimes you want a certain amount of care, you're asked to, take a flight out of the country to get that better care. Numerous times you will see persons on the TV, on the radio, asking for assistance to go abroad to get a better care. So I think that the opportunity is really great, and it's very important that we know how to prepare our workers or to prepare our students so that they can fill the gaps that are here and also abroad.